Welcome to View on Africa. My name is Simon Haysom. I'm a senior analyst with the Global Initiative Against Transnational Organized Crime. And I work on the ENACT project together with our partners ISS and Interpol. I am going to tell you today about our latest piece of work, a policy brief, Hiding in Plain Sight, Heroin's stealthy takeover of South Africa. This policy brief actually builds on a piece of research that we did last year that mapped for the first time in quite some detail how heroin actually moves through Southern and East Africa, which provides a large portion of one of the three main heroin routes in the world. About 90% of the world's heroin comes from Afghanistan, and now a substantial portion of that heroin is moving through the Southern and East African region, en route to lucrative Western markets. The previous report looked at the very severe impact that route was having on governance institutions, particularly in Kenya and Mozambique, where it had become very intertwined with political finance. At the same time, though, that we were studying this, what we thought was almost entirely a transit route, we realized that it had given rise to domestic markets, some of which have been present in countries along the coast for decades now, but which have grown significantly in the last few years. And South Africa, in particular, it emerged that as one of the region's biggest economy, had undergone a very profound expansion of its heroin economy. With this policy brief, we wanted to explore that landscape and to initiate a public debate about the heroin economy, the very severe impact it's having on South African society, and also how we as a society should respond. To that end, with some input from two other colleagues, I spoke to people using drugs, people involved in providing services to drug users, people involved in the drug trade itself and in the gangs that control turf in certain South African cities, and to people in law enforcement. I would say there were three key findings that emerged from the interviews that went into this policy brief, and they center around the spread of heroin consumption through South Africa, the growth of the underworld that's accompanied that spread, triggered that spread, and number three, the neglect of the issue. In terms of spread, heroin is being used across the country in a way that was very surprising. We've heard for a long time sort of news reports about Niobe use, but very rarely have all those reports been linked together to show that actually heroin is a nationwide issue. And not just an issue in major cities, though Tshwane, Cape Town, Johannesburg, Durban are profoundly affected by heroin. But it can also be found in large towns, small towns, even rural areas. Heroin has really has its tentacles everywhere in South Africa, almost. However, the population of people who use heroin is mostly poor and very marginalized. They are hidden out of sight. Either many people have become homeless through the marginalization that's accompanied drug use. They're living under bridges and railway reservations, or they are being looked after by families in neighborhoods which are poor and not marginalized themselves and don't attract a lot of media attention. There's also been a shift both from a sort of 2 decades ago, most heroin users in South Africa were white, probably from middle-class backgrounds, would inject, to most heroin users in South Africa are now poor, black, Many of them are smoking, but there's also a transition to injecting drug use, which carries much higher health risks for people who use drugs. Heroin has managed to spread all over the country through the growth of an illegal economy that provides for that to happen. It's been distributed by networks that have brought it into the country and have brought it to places of sale, and in some cases, have very deliberately tried to grow consumption of heroin. Heroin is a very attractive product for a drug enterprise. People need to take it very regularly to prevent withdrawal. And in South Africa, a pellet of heroin can be bought for as little as 20 rand in some parts of the country. As it's grown, more people have been pulled into the underworld as dealers, as pushers, very few of them, but some of them as kingpins, and also through the criminalization of drug users, more and more people have been brought into the criminal justice system and processed by the criminal justice system. As a cash-based economy, heroin is also very corrupting of street-level police officers. As such, we argue that heroin is really a key commodity underpinning the growth of the underworld in South Africa. Lastly, the issue has been, in several respects, quite neglected. As I said, the people who are using drugs come from marginalized communities. Their problems that have accompanied heroin use have been kept out of sight or ignored. Certainly in the public debate, and many of the secondary effects of the growth of this drug market, like surges in violence in places like Cape Town, where there's a high degree of competition over drug turf, are too easily metabolized in South African discourse as par for the course, rather than being seen as new shifts that urgently require concerted responses. And in particular, we feel that the state has been slow to understand the gravity of the situation, or to dedicate adequate resources to understanding it, preventative action, or reactionary measures. We are advocating three main responses, or we have three recommendations that fall into three categories. The first is a cross-border strategy. South Africa's situation is intimately tied to the issues that we dealt with in the previous report, where high-level corruption in neighboring states facilitates the trade, facilitates the movement of the product into the country. And that will require both sort of joint law enforcement responses, law enforcement in South Africa working with law enforcement in other countries, but it also requires a political response. The impact of a lot of the movement of heroin through neighboring countries is really felt very severely in South Africa. Within our own borders, though, there needs to be a step up of a national strategy to deal with the growth of heroin, with the existing population of people who are dependent on heroin. And that needs to bring in multiple stakeholders. We have some of the infrastructure for this already, but it's evidently not working, because at a local level, we find that local government, who's bearing the brunt of the crisis, is underprepared, both in terms of resources and in the range of policy solutions that they're applying to the problem. Lastly, at a community level, it's very important to understand heroin not just as a law enforcement issue. It's maybe primarily should be seen as a development issue. It's a spoiler for development. It's problematic heroin use and the policy regime that accompanies it will keep people in poverty. And it's highly corrosive of people's individual integrity and their familiar bonds. It's corrosive to communities as trust declines in the presence of a very acute substance abuse problem that has multiple effects. The long-term solution also to heroin should be seen also as an issue that also falls under substance abuse and gang violence in South Africa, and the drivers of why people become problematic substance abusers, why people join gangs, why violence becomes very acute in certain neighborhoods around the drug trade. The way that we deal with those in the long term rests on development issues, development drivers, and that needs to be part of the conversation in a very substantial way.